And welcome to the Dr. Bob Show. Are you having trouble remembering things? Oh, where did I put the keys to the car? Or where did I park my car? Or I walked in this room to do something, but I can't remember what it is. Or people are starting to say you're forgetting things and are repeating yourself frequently. Could there be something going wrong with your brain? We'll be spending most of this show talking about the brain, about memory, about a healthy brain, about what we can do to keep a healthy brain. My guest is Dr. John Dougherty. Dr. Dougherty is the medical director at the Cole Neuroscience Center at the University of Tennessee Medical Center. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about hearing loss. It sometimes gets worse as we get older. And pericarditis, is that different from a heart attack? A lot of information for you. You'll want to stay tuned. We're talking with Dr. John Dougherty, board-certified neurologist, medical director of the Cole Neuroscience Division at the University of Tennessee Medical Department. John, welcome to the Dr. Bob Show.
How are you?
You've been dealing a long time with people that are having problems with memory deficit, memory problem. How long has it been?
Oh, 25, maybe 30 years, but it's getting more and more interesting all along. New discoveries, new strategies, and we're able to not only diagnose, but treat patients better than we've done in the past.
So there are new findings, like in everything, we're getting smarter and smarter and smarter.
That's true, and we're getting more scans and other techniques that help us diagnose it early. Early treatment, particularly for Alzheimer's disease, is very important.
So making the diagnosis then early treatment is very, very important. You've, I want to put a little plug. You've written a book.
Yes.
Called Better Brain Health.
Yes.
What gave you the idea of writing a book on brain health? Because it's on everybody's mind?
Well, in a way, but it interests us, and we thought that we could make a contribution not only to diagnosis, but especially for helping laypersons understand the strategy of evaluation and treatment for Alzheimer's. And now, you know, particularly with diet and other things, it's so important, you know, to help the patient work through this problem.
So, Better Brain Health, and you can get that on Amazon.com.
Yes, and it's also available, I believe, in the bookstores here.
John, tell me about memory as we get older. Does the brain change? Does memory actually change?
The brain does change as you get older. Most of the studies have indicated that the change is subtle and benign. As I say sometimes, as you get older, as far as your brain is concerned, you get smarter and wiser. Early on, you become forgetful, ask the same question over and over again, and this sort of thing. And that makes it pathologic, and it needs an evaluation if that's the case.
So we get into what we call cognitive changes. What does cognitive mean?
Changes comes from, you know, the word incognito. That's somebody you don't, unknown. And that's what it means, cognitive changes that need to be investigated, understood better.
And so you've got cognitive changes. What about dementia? Where does that come in with cognitive changes?
we get the question so often, but maybe I can help with that, I hope. But anyway, dementia, the word dementia is like a big umbrella. There are many things that go under dementia. Now, 65% of the individuals with a dementia have Alzheimer's disease, but not everybody. There's vascular dementia, there's dementias associated with things like thyroid problems, so they all go under this big umbrella. And there's some new studies about not necessarily dementia, but other cognitive problems that are a little bit outside the dementia field, mild cognitive impairment, for example.
So mild cognitive impairment. Tell me about when somebody has dementia, how do you differentiate Alzheimer's from vascular dementia, from thyroid disease problems?
Sometimes it can be difficult, and with the new understanding of frontal lobe dementia, that is involving our thinking and objective types of evaluation of things that are located mostly in the frontal part of the brain. We've become much wiser in terms of mild cognitive impairment, and we're able to take the strict definition of mild cognitive impairment because in like 15% of the people, it's early Alzheimer's. In mild cognitive impairment, usually only one cognitive domain are involved, like they have trouble with memory, they don't have visual spatial problems, and the problems don't disrupt their social or professional activities. But we know about 15% of the people with mild cognitive impairment go on to develop Alzheimer's disease. 40% stay the same at 1 year, and about 15% actually improve. So it's a big spectrum, but it's very important to understand because it comes on very early in Alzheimer's, and we think that early treatment is one of the big clues to this whole process.
Do people deny it?
Oh, sure. It's not uncommon at all. There's a fancy word for it called anosognosia.
Boy, that's good.
And forget that word. What it means, though, is that you do not see realistically your own capabilities. Had a gentleman say, I've been driving 40 years, no problems, no accidents. He gets in the back seat of the car and accuses the family of stealing his steering wheel, and he's very impaired, but he has no a realization of the difficulty that he has. When driving, it can be a real problem.
Is it more, or are the people of the family more aware than the person? How do we bring somebody to the doctor? How do we find this early, if we suspect problems?
Yes, that can be very difficult. Yes, the family sometimes recognizes it long before the patient does. But there's different ways and strategies. I don't mean necessarily to coerce the patient, but sometimes, the family has to say, something's got to go here. We need to evaluate this and treat it. And we have medication that can be very helpful.
So if somebody suspects it, what kind of testing can be done to make the diagnosis?
Yeah. One of the things in Alzheimer's disease is that the domain, and we discussed this in our book in detail, that's abnormal in early Alzheimer's is the domain responsible for memory. Because there are other domains. There's another domain just a little further down in the brain that is responsible for verbal fluency, and that means like, oh, what's that thing on the wall with the hands and the numbers on it? Of course,
I know what it is. It's a
tip of the tongue. So that can be abnormal, and that's the second most common domain involved in Alzheimer's disease. So there are characteristic patterns. You examine a person and you say, this is Alzheimer's disease. Now we do diagnostic studies, MRI scans, and now there's new scans that are just coming online that actually label the amyloid in the brain itself. You can measure the strength of the amyloid, you can see what the problem is, how it's affecting the brain. That's been a big advance that's occurred just in the last few years.
So amyloid, what is amyloid and what does it do in the brain?
Well, in a way, that's a good question. The amyloid is the major protein involved in Alzheimer's disease. And the interesting thing about it is that it aggregates itself into clumps. It's not in the cell, but it goes up next to the cell and kills off the nerve cells without necessarily going into the cell itself and causing its death.
Now, I hear the word neurofibril tangles.
Yeah, neurofibrillary tangles.
So what is that? Is amyloid make
Well, not amyloid, and this was in the amyloid deposition and neurofibrillary tangles and nerve death were in the original description by Professor Alzheimer's descriptions of the pathology of Alzheimer's. Neurofibrillary tangles occur much more commonly in the front part of the brain, and they're responsible for frontotemporal dementias quite often, which is another type of dementia. But they're small tubules they're inside the nerve, where amyloid is outside the nerve. They kill the nerve off from being inside. And they're little tubules that used to keep the nerve in good shape. I mean, so, without collapsing on itself. And the neurofibrillary tangles results in the nerve cell collapsing on itself. It's inside the nerve and destroys the nerve in that way.
So that means thinking capacity and everything is messed up.
It's
a good word for it. John, is there treatment to slow down or prevent or to help Alzheimer's?
Well, there's treatment that should be tried in every person.
And that's what we're going to be talking about when we come back. There is treatment that should be tried in every person. We'll find out what that is. We're talking with Dr. John Dougherty, board-certified neurologist. We're talking about dementia. We're talking about cognitive impairment. We're talking about abnormal proteins, amyloid in the brain. John,
yes.
Tell me about differential diagnosis. What kind of illnesses can confuse the doctor with the diagnosis?
Well, vascular dementia is an important concept, and we understand a lot more about that than we used to, because we now recognize in many cases, if not most cases, it's the vascular dementia is related to damage of the very small arterioles in the brain itself. And so it kills off brain cells as a result of vascular changes in the blood vessel.
Yeah, lack of nourishment, more or less,
yes,
from those small arteries. So vascular dementia?
Small arteries.
Small arteries,
yes.
What?
Well, so-called secondary dementias are very important, and sometimes our physicians don't recognize these as a real pathologic process producing a dementia. I'm talking about thyroid, I'm talking about B12, which affects the nerve as well as the brain, and I'm certainly talking about depression, which is so important because we have pretty good treatment for seniors in terms of the medications for treating depression, and sometimes 20% of the people with Alzheimer's disease are depressed too. So the two combined can be important, Alzheimer's and depression.
Because you've got treatment for
yes.
both, and
yes.
1 + 1 = 2. So B12, thyroid, vascular, and depression.
Yes.
Treatment of Alzheimer's. Let's say if somebody's got Alzheimer's and you've made the diagnosis, early treatment, you said, was very, very important.
Yes, early treatment, and we'll talk in a minute about medications. There's Aricept, Exelon patch, and Namenda. They work, two of them work the same, cholinesterase inhibitors, and the Namenda works somewhat differently. They're not very effective. They're somewhat helpful, in some people more effective than in other people. It's the formal recommendation, however, of the American Academy of Neurology that all patients diagnosed, as you say, with Alzheimer's should be treated to measure the response. The medications are not associated with severe side effects. They're reasonably safe and should be tried. Of course,
can you measure the improvement in a patient?
Sometimes you can. You can measure their improvement by doing multiple cognitive tests, which is what we usually do in our clinic.
So you've got treatment with Aricept, Exelon. Yes. Next step in treatment? Well,
the next step, if not the most important step, is, believe it or not, physical exercise. And as we were talking a few minutes ago, it's not just physical exercise improves the blood vessel of the heart. It seems to result in the laying down of new nerve cells and proteins in the brain itself. A group from Columbia, New York, discovered this a few years ago, but it really has a reparative effect to the nerve cell in Alzheimer's disease. Exercise, physical exercise. One Mayo Clinic article recently suggested that if you walk 1 mile 3 times a week at a normal pace, it can show some improvement.
So you lay down new neurons, new brain cells that
yes.
are there. Does that happen just normally? If I go out and walk a mile 3 times a day and I don't have Alzheimer's? Is it going to still improve my?
Yeah, it's possible that it could result in some improvement, but it's not so dramatic as what one would see. We're starting at a different place with Alzheimer's disease.
So what about nutrition?
Well, you know, we recommend in general Mediterranean diet and
A lot of fruits, vegetables, nuts.
fish,
Yeah,
for
with
sure.
omega-3s.
Yes, absolutely. And, you know, other strategies as far as food are concerned. I'm not the authority on food
Sure.
and Alzheimer's disease. We have quite a bit of information in the book about it.
Tell me about, monoclonal antibodies. I didn't know anything about that, and treatment of Alzheimer's until you had mentioned it to me.
Yes.
Oh, that's a newer type treatment. Tell me about it.
Well, it's a protein that's in the body. I mean, there are many monoclonal antibodies that they can be manufactured outside the body and put into the body. It looked, some of the early data, and I'm talking about just a few years ago, was suggested it was not too helpful, somewhat disappointing studies. And then about a year ago, there was another monoclonal antibody identified that works a little differently. It attacks the aggregate around the cell, aggregates of protein, amyloid, yes. And that has a much more potentially important effect on the nerve itself.
Now, what would you look for if you got a monoclonal antibody that's directed toward the aggregate of amyloid that's creating a problem?
It would keep it from getting larger and hopefully keep it from killing off the nerve cells.
And then what would you see with the patient? No progression?
Possibly
less progression?
no, conceptually improvement even.
Yeah, even getting better.
This is very early, you know, early in the evaluation and treatment with monoclonal antibodies, but they're being used in many different fields, monoclonal antibody.
John, how about the support of family members that have, is that a key part to treatment?
Oh, very,
is the family?
very key part, Bob, and you know, I'm glad you asked, but we try to do everything. We have social work or whatever who can be tremendously helpful. Groups are very good too, and you realize that, you know, one of your loved ones has many of the same problems, someone else has many of the same problems that you're facing. And understanding, you know, certain things, difficulty with bladder control or vision or whatever, coming together as a group, they can learn a lot.
Yeah, it's like, oh, you mean you have that problem also? It makes
Yes.
people feel a little bit more comfortable that no other people have that
Absolutely.
same problem. John, what do you see in the future in Alzheimer's? People are getting older. There's more and more people are getting Alzheimer's.
Well, the trouble with Alzheimer's, of course, is that the most important risk factor is age. And when you're 85 years of age, you got about a 50-50 chance of having Alzheimer's. If you have a first-degree relative, it's about 10% more. But people are coming up with all kinds of things, and it's so important because I'm not sure that the healthcare system can really, you know, absorb the medical care that's needed for large groups of individuals with Alzheimer's disease. There are 5 million people now with Alzheimer's disease. In 2050, there'll be 15 million people with Alzheimer's disease. We've got to do something, and it's coming.
Will it be coming with better group medical care or with better medicines like monoclonal antibodies?
I think all of the above. You know, 60% of patients are not properly diagnosed when they go to the family physician. I mean, I'm not,
Sure.
you know, saying bad things about the general physicians in any way, but, you know, we've got to educate not only the individual, the family, but the physicians too in some cases.
Your advice, if there's a family member that seems to be having trouble remembering things, peculiar attitudes, socially becoming less well kept, what does the person do? Talk to their doctor?
Yes, absolutely. That's the first step, and you know, maybe they need a referral. I mean, honestly, what you're describing there is a frontotemporal dementia. That's another thing, you know, frontotemporal dementias 5 years ago, nobody talked about them much. And my associate, Dr. Crane, specializes in that area, and she's excellent, but now it's one of the hottest topics in all of neuroscience.
John, you're an amazing person. I want to personally thank you for all the good you have done for so many people that have had this devastating problem, and yet you're able to guide them toward the best life they can have.
Bob, it's so important to have someone like you that can carry the banner of teaching forward for the physician, for the patient. It's a great contribution that you make.
Well, thank you, John, and come back and see me again.
Okay.
Wonderful discussion on dementia, different problems, Alzheimer's, new treatment, early diagnosis and early treatment, very, very important. If you suspect this, talk it over with your doctor. And now you're going to want to stay tuned. We're going to be talking about problems with hearing and also pericarditis. What is that? I want to thank Dr. John Dougherty. Wonderful discussion on dementia, cognitive impairment. If that's going on in your family or people around you, be sure you see a doctor immediately. And now questions from you, the viewer, that I think are important to your health. Question number one, Dr. Bob. What is pericarditis? Well, pericarditis means around the heart. And around the heart, there's a little sac. It's called the pericardium. And in that pericardium, it protects the heart. There's a little fluid on the inside. It's sort of lubricating. It doesn't have a big purpose, but if it becomes inflamed with a viral infection or irritation, that can cause severe chest pain that can mimic a heart attack. Now, if the pericardium also gets irritated and produces fluid, the fluid between that sac and the heart can squeeze down on the heart. So somebody's ability to throw out blood to the rest of the body when the heart beats is impaired. So pericarditis, chest pain, worse when we lean forward, a rub when the doctor listens, it's a gravelly noise, is something that can be very, very serious and has to be treated. So it's like chest pain, persists, must see your doctor. Question number two, Dr. Bob, is there a way I can protect hearing loss as I get older? Excellent question. About 1 in 4 people at age 55 will have some form of hearing loss. Between 55 and 65, it's 1 out of 2 people, or 50%. It seems to be that the accumulation of loud noises, that can be from rock concerts, that could be from airplanes at the airport, it could be from honking horns, it could be industrial work, but constantly loud noises that are beating on the eardrum will destroy some of the fibers in what we call the cochlea, in the inner ear, that are responsible for hearing. So when that occurs, we get what we call presbycusis. And presbycusis means hearing difficulty at an older age. And frequently we have difficulty hearing certain noises, certain consonants that people speak. And also if you get in a crowd with other people, you can't differentiate the conversation. It's just, and what does that lead to? Well, sometimes it makes you withdraw. It makes you embarrassed to say, what did you say? Repeat what you say again. And it's a sign. Now, what can be done about that? Well, to prevent it, you can use earplugs. There are little sponge-like earplugs that you can use at concerts, or there are earplugs to keep sound if you're using loud, leaf blowers, any type of machinery that's causing noise. If you are around noise that leaves a ringing in your ears, you can tell that there's been damage that's been done. So protect your ears. You've only got 2 of them to hear with. If you're having hearing problem or you think you're having some hearing loss, get your hearing checked. You can get audiometrics where they'll be able to measure if there are certain tones and pitches that are causing problem. They'll see if you need a hearing aid, or they'll see if there's just an accumulation of wax in the ear. Very simple treatment to be able to hear good. Or if there's a ruptured eardrum that needs to be fixed. So if you're having hearing problems, be sure you see your doctor for good hearing health. Well, that's all the time that we have for the show. I hope you've enjoyed it as much as I have. Remember, Exercising, those 4 things we like to do, exercising, it now we know will lay down new nerve cells in the brain. So another reason, just simply walking a mile 3 times a week. But it reduces stress, it helps us lose weight, makes us feel better, we get a runner's high. Be sure that we're eating properly. Dr. Dougherty mentioned the Mediterranean diet. It's a diet of fruits and vegetables and nuts, fish, staying away from red meats and fried and fatty foods and foods that are not good for our health. 8 hours of sleep. There are so many people and so many problems because we don't sleep well. If you're not sleeping well or not giving yourself enough time to sleep, be sure that you correct that, because nothing like a good night's sleep. And then most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. You know, laughter is so important. The immune system works better in happy people. People that are happy and laugh with each other perform better. It makes people that surround them be happier and they perform better. It makes the entire atmosphere of the people you're in healthier and happier.